Dr. Chris Cormier here of the Nerve Health Institute. Now today I want to talk to you elite athletes around the country. Whether you're in high school or college or in the pros, you have to make sure that you protect your most valuable asset. Now as I'm talking to you today, you probably think, man, I'm great. You know, my 40 is really good. My vertical leap is really good. I'm really strong with my bench press and all these things. I've been training really hard. Well, guess what? There's something you're missing and you don't even know it, and nobody else knows it. No other doctors, no other trainers in the country know it except for this little handful of us called quantum neurologists. And what our specialty is, we actually look into your body. We check it out. We look at your breaker box and basically look through everything and figure out where your brain is connected, where it's not connected. So an example of this is if I'm gripping a football, if I just pick a football up in my hand, well, how am I doing this? I'm not doing it by the muscles in my hand, contrary to popular belief. I'm doing it by my brain. My brain has to have a wiring connection that comes from here down through my arm and into my hand, into the muscles in my hand. And if the signal here is really, really good and stuff is firing in milliseconds, then basically I'm capable, all these muscles are nice and strong. But if suddenly maybe the signal is not that good, maybe I took a hit to the side of my head and suddenly I tripped a breaker right here, or a couple of breakers right here. You don't know they exist. Your hand maybe has 70% of the strength that it used to have. Maybe it's just in one finger. Maybe you're a quarterback and you're picking up the ball, trying to throw the ball down the field. Well, how important is it for you to have maximum connectivity between your brain and this finger or this finger or this finger or your thumb? We're talking about major deals here. So there's nobody that's capable of diagnosing and correcting this stuff other than this very small group of us. And I have a book that's going to explain this. It's called The Hidden Diagnosis. It's going to be released this month. And basically you're going to get a much better idea of what the hidden diagnosis is. It's literally trip breakers. Now, our human brains have thousands of breakers. So as football players, you're not going to have problems only in this vicinity. It could be in the knee. So let's talk about this. Let's say you're a player, like I recently saw a player who had a really bad wiring connection and in his leg, and he had no idea. He had a hidden diagnosis that was there. Well, before he came to see me, he was just on the field one day and he's running around and he makes a cut and he tears his ACL. The ACL is this big around. I mean, depending on your size and stature, but it's a very big ligament that's inside of your knee. How does that ligament just tear with no contact? Well, I'll tell you how it does is if the connectivity between your brain and the wire that comes down into this part of your leg suddenly is weak. You don't know it's there. You go into the gym, you're working out, you're thinking you're strong, but nobody is specifically testing these parts of your body to determine how well connected your brain is to this specific region. And so in this particular athlete's case, he had a weak connection before the ACL was torn. And that's what I contend, because I didn't see the patient until after he had ACL construction, and then he ended up going through months of physical therapy and they were about to put him back on the field. His doctors, everybody had cleared him. Well, this leg, when I tested it originally, was rock solid strong. He could pull his foot straight across and he had no weakness whatsoever. Conversely, this leg was terribly weak and his knee was very unstable, and the signal between the wire coming from his brain down through the lower part of the back into a specific region of his leg was not connected very well. This guy was about to get back on the field, and literally it would have been out of sheer luck that he wouldn't have ruptured his ACL again. So within seconds we were able to diagnose this hidden diagnosis that he had and correct it. And this guy went back on the field and played his whole senior season with no ACL problems. So this is the sort of stuff that we're seeing. This is the future of the elite athlete. It's the future of athletics, and you need to get on board and you need to call one of us. My name is Dr. Chris Cormier. I have the Nerve Health Institute. We have athletes that come in to see us from all over, and we're in Lafayette, Louisiana. So get a hold of us, get a hold of my book, and take a look at our information.